Evening, everyone. Welcome. This event is being hosted by Crohn's and Colitis UK, and it's for everyone who's affected by Crohn's and Colitis, Crohn's or colitis. So there might be you, might be a family member or someone that you care for. So we thought it would be really useful to hold this event with increasing numbers and a new variant. We know that everyone has lots of questions. This is a really rapidly changing picture, so we don't have all the answers, but we will share what we do know now, and then please keep an eye on the Crohn's and Colitis UK website, which we will be keeping continually updated with new information as it becomes available. So this event is an opportunity to update you and answer some frequently asked questions about the latest evidence about COVID-19 vaccines and IBD, risk levels and the need for extra precautions, new treatments for COVID-19, and also covering, with Christmas coming up, what to do if you're unwell over the Christmas period. You might be watching this as a recording, so if that's the case, be aware that the situation may have changed since we made this recording, and check the government and the Crohn's and Colitis UK website for any updates. So we've been talking to policymakers, NHS leaders and politicians about the difficulties you've been experiencing in getting the COVID vaccine and accessing care and treatments. And we'll be continuing to work with other patient organisations and clinicians to make sure your needs are heard and met. So tonight we won't be giving specific medical advice, but we'll mention resources as we go along that you might find helpful, and we'll also be posting useful links in the chat so you can seek support if you're finding things difficult. And we'll also be taking some of the questions from the chat as well and asking our panelists tonight. So please be respectful to everyone attending when you post comments in the chat. So I'm now going to ask our panel to introduce themselves, and then we'll get on with the presentations this evening. So I'm going to start with Kerry, if you could introduce yourself, please.
Hello, I'm Kerry Robinson. I'm an IBD nurse in Sheffield.
Thanks, Kerry. And Nick Powell.
Hi, thank you so much. Pleasure to participate. My name's Nick Powell. I'm a gastroenterologist at Imperial in London.
Thanks, Nick. And Tarek.
Hello, everybody. Tarek Ahmed, I'm a consultant gastroenterologist in Exeter.
And Nick Kennedy.
Hi, I'm Nick Kennedy. I'm a consultant gastroenterologist, also in Exeter with Tarek.
And Charlie.
Oh, hi, everyone. So I'm Charlie Lees. I'm a gastroenterologist in Edinburgh.
So a huge thank you to our panel for joining us tonight. It's really fantastic to have you on the call. And I'm going to hand over now to Charlie to kick us off with a bit of an introduction.
Well, thanks, Ruth, and thanks to the whole team of people working very hard at the background in Crohn's and Colitis UK to help us put this event on at very short notice. Ruth and I were talking about this as early as the middle of last week, and we've been thinking about how we can best bring together the relevant experts to help answer your questions around COVID right now. Just by way of introduction, this is a very, very fast moving area. Feels like we've said that, pretty much throughout the pandemic, but that has always been very true at times of great uncertainty. And I suspect many of you at home have a sort of sense of maybe dread, maybe anxiety, maybe deja vu that here we are the week before Christmas with this level of uncertainty that there is around us all just now. We decided to put this on as early as we could so that we weren't caught up in the midst of the festive period. And I suspect quite a lot of the uncertainty will become evident one way or the other whilst people are off over Christmas and New Year, hopefully relaxing and hopefully not getting too worried. So we will do our very best today to try and answer things as fully as we can, but we will also be the first to say that we don't know, where we're not sure what the specific answers to various questions are. Why are we here? Well, we're here because there's a new variant of the COVID-19 virus, the SARS-CoV-2 virus that is called Omicron. We know that now. It's been very widely publicized, of course. And it really has kicked the pandemic into a totally different gear and caused all the policymakers and the scientists and the clinicians to scramble to try and get answers around vaccine effectiveness, around the effectiveness of medicines, around how transmissible this variant is. Will it result in the same level of hospitalizations and unfortunately deaths, or will there be some differences with this new variant? What we know is that this variant's really very, very different from the original SARS-CoV-2 virus. It's heavily mutated, and it's been heavily mutated in and around the spike protein, which is the key for the virus for two reasons. One is it's because it's the key that helps the virus get into cells, and secondly, it's the target for the vaccines. And so that's why it's had this big change in the way that the virus is acting, and also this uncertainty around the effectiveness of the vaccines that we have. We are in a really very different position from where we were a year ago, because we know a lot about this virus, and we know a lot around COVID, and it appears that most of that solid base of knowledge really does apply very equally to Omicron, with a couple of differences. The thing that appears very real is the fact that the Omicron variant transmits from one person to another very, very easily, very rapidly, and that's why everything has changed so quickly. You know, it was already a virus that spread quickly through communities, but now it's passing through very, very quickly indeed. We know that the vaccines are not hopeless. We know that they are working to a point, and we'll discuss this in more detail for sure. But it does look like, if you take IBD out of it for a moment, that once people have had 3 doses of the vaccine, that there is good protection against symptomatic COVID. And we expect that there will be really good protection against getting hospitalized and severe COVID, ITU admissions and deaths. What we don't yet know is how much that will apply to people who've just had 2 doses of the vaccine, for example. So we're going to come to dial into these in a bit more detail. We're going to address your questions as best we possibly can. We're going to get Tarek and Nick to talk us through the latest data that we've learned from the Clarity IBD study, looking at vaccine responses in patients on infliximab and vedolizumab. We're going to get Nick Powell to talk us through some of the early findings from the VIP study, where we've been looking at some of the other medicines that people take for IBD, tofacitinib, ustekinumab, azathioprine, for example. We're going to talk around what we know about the risks, and there's a spoiler there, which is that overall, we've been very reassured that there doesn't appear to be any increased risk of adverse outcomes by and large for people with IBD. Really reassuring, really helpful for us throughout this pandemic. We've been cautious, I think, in the advice that we've been given, but that's the first important message. And Tarek's going to show us some nice and reassuring data on the vaccine effectiveness in a short while as well. And then really great that Kerry's joined us, because we want to get the perspective from the IBD specialist nurse. And one of the things that Ruth brought to our attention is the number of people that are really struggling to get through to helplines at the moment to get advice. We know that that's a big challenge and a big worry, and it's difficult enough over the festive period, but I think lots of nurses are having to be redeployed a little differently this time, because it's not so much to cover shifts, people being sick, but it's to cover staff absences and things. Okay, I think that's enough of me talking right now. What I'm going to do is I'm going to go straight to Tarek. Tarek has led the Clarity study along with Nick, and Tarek is going to talk us through some of the very latest updates from Clarity. Tarek's got a few slides. Tarek's the only person that's got slides tonight, but these are, I think, really helpful and important to help visualize what we know. Tarek.
Thank you, Charlie. So many people on this listening to this today will be involved in Clarity IBD. Clarity IBD is a study that we set up in September 2020 to try and investigate whether the drugs that we use in inflammatory bowel disease impair immunity that follows either infection or vaccination. So this is a study that's been conducted across the whole of the UK from 92 hospitals, and we have more than 7,000 patients actually involved in the study. These patients were either receiving infliximab or vedolizumab, and we selected people being treated with infliximab because previous studies have shown us that infliximab increases your risk of getting infections, and it also impairs vaccine responses, whereas vedolizumab does not. So vedolizumab treated individuals were, I guess, our comparison group that we could compare outcomes. And we managed to recruit a large number of people in a 12-week period running up to Christmas 2020. Most of the work of this study was actually done by the participants who completed questionnaires every 8 weeks and donated a blood sample at each infusion visit. What we did was we linked data regarding PCR testing and vaccine data to the information that we collected that was given to us by the participants, and we have looked at various outcomes. Prior to vaccination, when that started, if you remember, in December 2020, we showed that antibody levels after infection were reduced in people treated with infliximab compared to people treated with vedolizumab. But the good news was that there didn't seem to be an increased risk of infections, hospitalizations, or bad outcomes in people treated with infliximab. So no difference. But antibodies, as I said, were reduced. We then studied antibody and T-cell responses after vaccination and showed that antibody levels are reduced after vaccination in people treated with infliximab. And this probably applies to other anti-TNF medicines as well. Now, here are the antibody levels, and I'm going to try and talk you through these graphs. On the in both of these graphs, this is taking individuals in the study who have not had COVID-19, looking at the antibody levels after a second dose of vaccine. And what you can see is that, and this is over time, measuring antibody levels over time, up to 30 weeks here. And you can see that infliximab treated people in green have lower antibody levels after 2 doses, and that the antibody levels decline quicker to this sort of threshold that we felt was probably significant of 15 units per mil. So infliximab treated people have lower peaks, they fall faster. And we see this both with the Pfizer vaccinated individuals as well as people vaccinated with AstraZeneca. Now, on the bottom of this slide, these are people who've had COVID-19 as well as 2 doses of vaccine. And what you can see is that in these individuals, antibody levels stay up for much longer. And this is now, of course, widely reported that the super protected people are those, super immune people are those that have had an infection and 2 doses of vaccine. Now, so this is after 2 doses of vaccine. And of course, this looks a little bit worrying that antibody levels at week 24 or thereabouts are low, particularly in people treated with infliximab. But the good news is that after a 3rd dose of vaccine, this is marked as this vertical line here, you can see that antibody levels rise significantly for both infliximab and vedolizumab treated patients. In fact, antibody levels after a 3rd dose, it's actually a 3rd primary dose, are approximately 10-fold higher than they were immediately after 2 doses of vaccine. And we see this both for people who had 3 doses of Pfizer vaccine and people who had 2 doses of AstraZeneca and then a 3rd dose with a Pfizer. So that looks pretty reassuring, at least in the short term. Antibody levels are high, and again we see a similar high level in people with prior infection. So this is early days. It doesn't tell us about how antibody levels fall over time, but we will continue to collect this data in the Clarity study. So what does this mean in the Omicron era? And it's important to remember that the data that we've collected so far has been predominantly in the Delta era and the earlier variants. So what this means now is a bit uncertain, and you're going to hear this word repeated several times over the next 45 minutes. We do see good antibody levels, high antibody levels. Clearly, that's not the only story. It's also about T cells as well. But we know from the work from Pfizer that in people aged over 50, a third dose, there's 94% vaccine effectiveness against symptomatic disease. But again, this was pre-Omicron. We also have some laboratory data now showing that 3 doses of Pfizer vaccine increases neutralizing antibody titers by 25-fold compared to 2 doses against the Omicron variant. So in order to have protection, these data suggest that you need to have 3 doses of vaccine. And this is, of course, what the government's encouraging us all to do. But of course, you know, we are talking today about people with inflammatory bowel disease, in particular people on anti-TNF therapy, in whom we don't know much about the effectiveness of 3 doses of vaccine or the durability, but further data will of course come in time. But for now, based on the information we have, I think we should all be careful.
Thank you, Tarek. That's really, really helpful. And I think incredibly reassuring to see that it really does look like that 3rd primary dose is making a big difference to the antibody levels in people, despite being on infliximab, and that's a 3rd dose of an mRNA vaccine. And it doesn't matter which vaccine you had the first 2 doses of, you're seeing a similar spike. They're going right up to the same level at all. So I think across the UK at least, the uptake of those 3rd primary doses has been really very good. And so we anticipate that this will be providing most people with good levels of protection, although we just, as Tarek says, there is a degree of uncertainty left here. So that's a 3rd primary dose. There is, of course, a booster dose then still available to people who've had a 3rd primary dose. And we might talk a bit later about some of the practicalities and the logistic issues around that. But just to remind people that you're eligible for your booster dose, that would be your 4th dose, 3 months after you had your 3rd dose. So there's quite a lot of people that are falling into that range just now. And I know that the vaccine centers are extremely busy just now, but one would anticipate space freeing up if not already over the next week. So do look still to go and get your 4th dose, your booster dose, I think, especially if you're on an anti-TNF drug. Nick, Powell, I want to come to you straight away next, I think, and we'll come back with some more questions on the vaccines for Tarek and others, because one of the big things that we've not really known is how this applies to other drugs. But Clarity's given us this exquisite data on anti-TNF in the form of infliximab and mono and combo therapy. But lots of our patients take other drugs, either azathioprine by itself or mercaptopurine or methotrexate or ustekinumab or tofacitinib. And so I know that you've got some helpful data already from the VIP study to inform us on that.
Yeah, thanks, Charlie. Well, I mean, Clarity has been a fabulous study in sort of telling us that you know, you get not as good antibodies if you're on infliximab. And you're right, one of the questions lots of patients are asking us is, what about the other drugs? So VIP is the ugly sister study, if you like, of Clarity. And it's designed exactly for that, to kind of look at the impact of other drugs. And also we've got a group of non-IBD subjects in that study as well, to allow us to directly compare, you know, how well people without IBD responded, and to compare our IBD patients. And I suppose some of the headlines of that, much like in Clarity, we corroborated those data. So we also saw in this, again, multi-center study across the UK, significant reduction in the number of protective antibodies that the vaccine generates in those patients taking infliximab. The other headlines were, if you were taking vedolizumab, we really saw no difference to our non-IBD population in terms of antibodies. So they were generated really good antibody responses. Those patients taking thiopurines, which again, that is very many of a good deal of our patients with IBD. For those patients taking just thiopurine, so azathioprine, acatopurine, no meaningful impact on the ability to the vaccine to generate those antibodies, which again, very reassuring for us. And a similar situation with ustekinumab, there was no, again, really big difference between the ustekinumab group and our healthy non-IBD population. The other group that's kind of now starting to stick out, and I should say in advance, there were fewer of these patients in VIP, but those patients taking tofacitinib, we also saw a reduction in the ability to generate antibodies. Now, the magnitude of that change wasn't as we saw with infliximab, but it was probably about half the response that you would see in a non-IBD population. One important point to make, though, across all of those groups, the patients did generate antibodies. So we're looking at suboptimal responses here. This isn't all a bad news story. People did respond to the vaccines. And a number of studies now in IBD have looked at whether the vaccines are protective for those patients and confirmed that they are across the IBD population. And I think the fabulous thing from the data that Tariq has just shown is that once you then get exposed to a third dose, well, your antibodies really do stack up and are probably protective. And I find that really encouraging and really motivating to engage with that third dose.
Thanks, Nick. So overall, that's a really encouraging message, isn't it? So most people shouldn't be overly worried here, really, and the data that Tariq's shown. Tariq, do you want to just mention, I think there's already some data from Clarity about breakthrough infections after 2 doses of vaccine. Is that right now?
Yes, Charlie. So breakthrough infections are infections that occur, or COVID-19 infections that occur after 2 doses. And the rate is very low, even for people treated with infliximab. So 1% of our study population have been admitted to hospital after 2 doses of vaccine. Sorry, 1% of people with a breakthrough infection, I should say, have been admitted. So a small number of people have had breakthrough, perhaps 5 or 6%, only 1% have been admitted. So it clearly provides some protection.
And that's with Delta. Obviously, that might be a bit different with Omicron. Nick, just in terms of the T cells responses as well, we've always said, there's antibodies and there's T cells, and we've seen throughout with the infliximab group from Clarity that there are good T cell responses, even in some people that had very low antibody responses. Can you maybe just give us a reminder, the T cells we think are more important to kick in later that stop you maybe getting sicker and needing hospital or further advanced care? Is that right?
Yeah, I mean, it's quite hard to tease out which of the parts of that immune response is most important. Clearly, the antibodies, that they do play an important role, but the cells, they're really the generals of the immune system. So getting them mobilized is also really helpful too. And I took great encouragement seeing that there were detectable and measurable T cell responses in those patients taking infliximab. Even a sort of suggestion they may even be slightly augmented. And that's another potential good news story here that and may account for why we're not seeing severe infection overrepresented in our IBD populations. And we know that across those immune diseases, people with arthritis, again, those people taking anti-TNF have not really shown high risks of infection. We don't know about Omicron yet, but nothing's leading us to suggest that that's going to act disproportionately to the other variants that we've seen. Even some hope that it may be less severe, of course, but that needs verification, of course. But lots of encouraging signs there, I would say.
So to summarize a bit of this to the point, so infliximab does seem to decrease the response to the vaccine. We certainly saw that after 1 dose. We saw that after 2 doses, the antibody levels decayed quite quickly. But we were still optimistic that people would have T-cell responses that would provide at least some protection. And then that 3rd primary dose really does look like it restores antibody levels to a level that's higher after 2 doses. So we do still want people to exercise a degree of caution, but overall, we think this is a reassuring piece of data. Nick Kennedy, I wanted to just ask you, because we've learned a fair bit now about the risks of these medicines and people getting bad COVID outcomes or not getting bad COVID outcomes. And I wonder if you could maybe just tell us a little bit about what we've learned from the big open safety study and other bits of work there.
Sure, thanks, Charlie. So we've looked at this in Clarity as well, and I think the message is certainly in the pre-vaccine era that the drugs we use to treat inflammatory bowel disease don't have much, if any, impact on the risk of severe outcomes from COVID-19. Charlie talked about the open safety study. This is something that should be published shortly, although there's a preprint available now. But this was a cross-immune-mediated inflammatory disease study, so looking at patients with rheumatoid arthritis and psoriasis and other inflammatory conditions, as well as Crohn's and colitis. We showed little difference between patients with IBD and the general population in that study, and we didn't really see any concerning signals for any of the drugs that we use to treat IBD. There are some data from elsewhere that might suggest anti-TNFs might even be protective from severe COVID, although I don't think we know that definitively. They are drugs that have been used in some of the platform trials, but I haven't seen any results presented on those. There's also some data showing possibly protection from JAK inhibitors, including tofacitinib, against severe COVID. And that's using at a different phase, perhaps when people have already got the infection and are then at risk of sort of severe complications from it. But I still think it's perhaps a reassuring message overall. What we've shown in Clarity with the breakthrough data is that because of the impact that anti-TNFs have on vaccine responses, that may lead to a difference, at least in the rates of acquiring the infection between those who were on infliximab at the time of their vaccination. But we saw very low rates of severe disease in Clarity. So I think, again, I'd be reasonably reassured by that.
Yeah, thanks, Nick. So we think that high-dose steroids remain slightly the bad guy here. So we would just be a little cautious around that, I think. But overall, the key message that we have said all the way throughout the pandemic is don't stop your medicines because you're worried about COVID. By far and away, the best thing that you can do is keep taking your medicines. That keeps your disease stable. That stops it flaring, because having active disease is a risk. Might then need steroids or hospitalization, which would both potentially put you at an increased risk. So keep taking your medicines. Please don't stop them now, and get your vaccines. I want to come to Kerry next. Kerry, I wonder, from your perspective, manning what I can imagine have been at times furiously busy helplines and speaking to patients, what your understanding is of patients' concerns and how that's maybe changed recently, people managing to get their vaccines and 3rd doses and boosters.
Hi, thank you. Thanks, Charlie. I think initially, obviously, it was just the panic of it and the drugs people were taking. The more recent queries the majority have been around the vaccine. And particularly, I think people are worried, the people who got the booster before the information came out about the 3rd dose, and they're now worried whether they can get a booster. That's been a common theme that we've been getting through from people. And I think it's difficult because on the NHS website, you can't book, I don't think, as far as I'm aware, you can't book a booster if you've had 3 doses. You need to go to either contact your GP, or we're advising go to a vaccination centre, but take your letter that says you're eligible for the 3rd dose so that you can then get your booster 3 months later. So yeah, that's been the concern for most of our patients recently.
Carry on that. I think it depends a bit on how your 3rd dose was registered. I think the idea is that patients who had a 3rd dose registered as such should be able to book their booster through the NHS website, but our local experience has been that hasn't always worked as well as it should have done. And I think we've also been told that patients who have a letter with their eligibility for a 3rd primary dose don't need a new letter they can take their third primary dose letter to a vaccine centre and should be able to access it. But it's I think there has been a bit of confusion sometimes between third primary doses and boosters, and that perhaps has become even more important now in the era where people can get a fourth dose effectively as well.
Yeah.
So Kerry, just remind everyone then, just so we've got this absolutely nailed down, the difference between a third dose and a booster.
So the third dose for those who are eligible is part of your primary immunisation. So it's like the first 2 doses for those 2 people who weren't eligible. If you're eligible for the third dose, you are then eligible for a booster 3 months later. And as we've seen, as the levels can drop off, really important if you're coming up due for that you start making plans, you can book in for that or make arrangements to get that done.
Just to come back to Tarek briefly, and then Ruth, if you could let us know what questions you've got from us that have been coming in. So Tarek, do we know anything yet about decay after the third dose, or is it just too early to say?
Yeah, I think at the moment, most people in the study, we've just got a single data point after the third dose. So, but provided participants stay in the study, we should be able to answer that question in the coming weeks.
Thank you. Ruth.
Thank you. Yes, lots of comments coming in about the third doses, the boosters, and when you're eligible for that fourth dose or that booster if you've had a third dose. So it was really great to get that clarified, and really great to hear about the latest evidence as well that we're seeing about the vaccines and the different drugs. So that's really, really helpful. I guess with all of that in mind, something that we're asked a lot is, what does that actually mean for me practically in terms of socializing, or, you know, we used to shield, should we still be shielding? It'd be really great to get your views on that and your advice on that.
Yeah, Kerry, we'll start with you actually, maybe in terms of what you've been saying to people practically when they're phoning up with these kinds of queries.
Yeah, I mean, we haven't been advising people to shield, but I think it's really important to practice social distancing, wear a mask. And I think just as the advice sort of from Chris Whitty, I think we've been saying prioritise your contacts, especially around Christmas. I think that's been the main thing. And I think if you are planning on meeting up at, you know, around Christmas time, not Christmas Day particularly, but, you know, think about meeting up outdoors like we did last time, go for walks with your friends rather than meet. I think the indoor mixing is a real concern. So they're the main kind of things that we're saying to people. But I think definitely be cautious and practice distancing, wash your hands, wear the mask.
And lateral flow tests. So just to reiterate to people, the lateral flow tests, they do work really well, actually, and they work well against Omicron. We know that now. They do need to be done really close to the time. So, you know, it's no good people saying, I did one a couple of days ago, or even I did one yesterday. If you're having people round for lunch, get them to do one that morning. If they're coming round for dinner, get them to do it in the afternoon, because with Omicron, it looks like they can change quite quickly. But that's a really useful extra safeguard that you can put into place, I think, to help keep you safe over the period. Does anyone else have any comments on that? There's a question here. Why aren't we tested after the third dose to see if we require a booster? Nick Powell, do you want to come in and tackle that one?
Yeah, I mean, I think that would be a great idea. The practicality of that, bringing people to hospital to do tests, you know, from my perspective, I think the way to deal with this is just to boost. And I'm actually delighted that there'll be a fourth dose, you know, just to capture any waning immunity that is sort of happening. In January, a lot of people will be starting to become eligible for that. So even if there is waning immunity, there's a proactive response to that. So you almost don't need to be tested. You're going to be eligible for further sort of augmentation of that response. So I think that's the key, and I really do, you know, I sense that all the social distancing measures are totally appropriate, but I'm a big fan of the booster sort of cascade that's going on at the moment. And I think that really is the key for people to get good immunity to this. But I think emphasizing everything that Kerry just said, it's very easy just to have been complacent about those things and forgetting all those simple measures, but actually they need double downing on. If that's the term to use, washing your hands even more than you did. This is more transmissible than before. Wear your mask. Those outdoor spaces, that ventilation, I think is absolutely critical. So booster and social distancing is my solution for myself as well as everybody else, actually, for that matter. Thanks, Nick. And Kerry, those were really, really helpful answers. I'm sure lots of practical takeaways for people there. I'm going to change gear a little bit now, because there's an extra element to this now that we haven't had before, and that's new treatments for COVID. So before, we've been talking about trying to prevent it by non-pharmacological measures, like we've just been talking, masks and ventilation, etc., and social distancing measures. And we've been talking about the vaccines a lot, but there are now finally really new treatments that can actually be used to treat COVID if you get an infection. So I'm going to ask Nick Kennedy to maybe just give us a brief overview of those treatments and what they are and what's currently available, because this is a very new, fresh area. Nick.
Thanks, Charlie. So many of you may have heard that there have been these drugs coming for a little while now, and there are a number of them that have been shown in trials, not in IBD patients perhaps, but in the general population, to be effective at reducing the risk of severe outcomes from COVID. So there are a couple of monoclonal antibody type drugs, so similar in principle to the drugs we use to treat IBD, but obviously in this case directed against the virus. So sotrovimab and a cocktail antibodies known as Regeneron. I suspect we'll see more of the first of those used because the second has been shown not to be effective against Omicron, but they might both be in use, at least for now, while there's still some Delta around. And then there are some oral drugs which are perhaps easier to administer. So molnupiravir is the one that is already available in the UK, and Paxlovid will be coming next year. They're all in limited supply at the moment, and the government are therefore trying to prioritize certain groups to receive those drugs. They're only being given early in the infection, so in people who've been symptomatic for less than a week and you've had a PCR positive within the last 3 days. And then there are some priority groups around people who are perhaps at greater risk of either poor vaccine responses or severe disease, which do include some people with inflammatory bowel disease. The criteria are not worded perhaps always as clearly as they could be in that regard, but it's something we're working on developing a better understanding of in the IBD community and working with the Department of Health. And Crohn's Colitis UK will keep all of you updated as to what those mean. I think for now, there will be local decision making, particularly because the access to the drugs is limited. And so it may be a case if there's uncertainty and you've had a positive test, it's something you can discuss with the 119 service in England or the equivalent in the devolved nations, and potentially also with IBD teams via the IBD helpline. So some of you may also have been receiving letters or from the government which will suggest you are on a priority list, which may mean you get contacted at the point of a positive PCR by a local COVID MDU to decide if you meet those criteria. The letters don't necessarily mean you'll be offered the treatment, but it does mean that someone may contact you to assess that eligibility in the event of a positive PCR.
Thanks, Nick. I think the important point to emphasize is that there are national guidance in place, but it's down to local implementation. And we might briefly just highlight how this is working in some of the parts of the country that we work in. This is if you have symptomatic and PCR positive COVID-19. So it's not if you've got a positive lateral flow test. It's not if you've tested positive with a household contact, but you have no symptoms. It's not if you've got a household contact and you've got a negative test. So if you have symptoms consistent with COVID, and the list is very long actually. So this is an expanded list of symptoms. It's not just the few early on, and you have a PCR positive test. So if you have a positive lateral flow test, go and get a PCR test as early as possible, because you then need to get access to the treatment within 5 days. They only work if they're given early, when the virus levels are high, and you will then, when you get through to a person, be screened, and they will then work out whether or not you're eligible for the drug. Kerry, how are you doing this locally, your end?
Well, our infectious disease team are setting up a unit for patients to go to and have this treatment. But I think they are just in the process of setting that up at the moment, obviously with the logistics of where and staffing and things like that.
That's very, very similar to us, actually. So we've got instructions via our helpline. So if people phone up, they're then instructed to phone a phone number that takes through to the infectious diseases unit, and they will then handle everything from there. Nick, Paul, or Tarek, does one of you want to come in and just explain just a little bit more about these treatments? Because they're given quite differently, aren't they? Tarek, maybe?
Yeah, so Setrusumab is an antibody drug that Nick's already mentioned that targets the virus. It's given as a one-off infusion, and it's been shown in people with risk factors for severe COVID to reduce the chance of hospitalization or death. In people that receive the drug, this is interim data that was published in the New England Journal last week. Only 1% of people who got the drug were hospitalized or died, compared to 7% who received placebo. And the good thing about this drug is it's an antibody that targets a part of the virus that isn't subject to change as a result of new variants. So it's like it will work for Omicron, we know that, but it may well work, or it should work for subsequent variants as well. So that's kind of reassuring that we've got drugs like this. It will be available in all UK hospitals, and as others have already said, the mode of access to get that is going to be, at the moment at least, it's going to be down to individual sites to organise it.
And some people might get invited to take part in the panoramic study. Could you maybe just tell people briefly what that is, Tarek?
Yeah, so the panoramic study is what's called a platform trial. So this is a type of study that can investigate several new treatments simultaneously, and it can add new treatments as the trial progresses. At the moment, it involves just one drug, the molnupiravir that we've already heard about, and this is the oral antivirus drug. And the great thing about this is that people can self-refer to the study. We'll put the website in the chat so that people can look at this. But essentially, you either need to be over 50 to be eligible, so anybody over 50 is eligible, or you need to be under 50 but over 18, so it's adults only, and have an underlying condition. And it seems likely that IBD will be included in that. And you need to have had a positive PCR test within the past week, and you need to have had symptoms for less than or equal to 5 days. So if you can't get access to the intravenous antibody at your hospital, then you might want to think about participating in this trial. Of course, you may not get the actual drug, you might get placebo, but I think the randomization is currently 50% chance of getting the drug. The great thing is you don't need to attend hospital to take part. You can log in online, and you will then be contacted by a study nurse or doctor who will talk you through the trial and then arrange for the drug to be couriered to your house. So it's easy to do.
I should add that these antiviral drugs have even harder to spell and pronounce names than the drugs that we use to treat inflammatory bowel disease, which some of you may have thought not possible, but indeed it is. I think we all struggle with them a little bit here. So what we don't want people to do is to get worried or unnecessarily confused about this. If you feel rubbish, if you've got a positive PCR test, if you phone up locally, or as Nick says, go via the standard NHS channels will point you in the right direction, and you'll be assessed to see if you're eligible. We don't know if people will need these drugs. If we look at everyone that we know about in our IBD population. And as Nick Kennedy was saying earlier, you know, if you're in the midst of a flare state and you're on high dose steroids, so that's sort of 20 milligrams or more of prednisolone taken each day, then that's the kind of person that you should definitely, I think, be phoning up to look to see if you can access these treatments. If you're completely well on vedolizumab, then you're probably not eligible, just to give a bit of color to that. But all the local teams will have all the relevant guidance at play. Ruth, do you have questions, comments to come in from the chat to feed in at this point?
I think the question that we're asked most is if people who think they are eligible for the direct access to antivirals, but they haven't actually had a letter. And it may be that we don't actually have clear advice on that yet, but I was just wondering if, you know, if there's anything you could advise for people in that situation.
Who wants to come in and answer that question?
Well, I can, if you like. So, Charlie, I mean, I think we know that the national list is not going to be up to date. There will be people that are on the list that shouldn't be on the list, and likewise, there's going to be people that are not on the national list. So, if you don't get a letter, don't panic, I think. But if you do have a positive PCR test, then contact your local team. Some centres around the country are actually proactively contacting their patients that might be at risk. So you may get local letters as well as national letters. But if in doubt, if you get a positive PCR, try and make contact either with your local team if you can, or contact 119.
Kerry, did you want to add something to that?
No, I was going to say the same.
Okay, great. Does anyone want to come in with anything else or any other questions on these new treatments?
I guess one question people might have is whether we perceive there to be any problems with them in patients on IBD treatments. And as far as we're aware, then there aren't any issues with these new drugs and the treatments we use commonly for IBD, but they won't have been used widely in that patient population yet. So it's obviously something we'll continue to look at. There's no reason for concern from that perspective. And if you're offered those treatments, obviously it's something you should discuss with your local team at the point of delivery, but it's something we'd have thought you should go ahead with. There are some specific studies going on to look at whether these treatments might even be used in an earlier phase in people at risk before they've even acquired COVID-19, and they may end up having a role in that setting as well. But that's obviously somewhere away from clinical practice.
So to summarize so far, then we've got quite a lot of good information now, and I think overall a reassuring message from data that we've generated thanks to many of you in the UK to help inform us that people with inflammatory bowel disease don't appear to be at increased risk of severe COVID outcomes, that there are some people, particularly those on anti-TNF therapy, in whom the vaccine responses are suboptimal, but we now know that a third primary dose, and we anticipate then further from a booster after that, really does restore antibody levels to a very good level, and that the T cell responses are uncoupled from that, so providing a different layer of protection that are not affected by the anti-TNF drugs. And now if you do get COVID, and you know the reality is that lots of people are going to be exposed to Omicron over the next period of time, then please don't worry. We have these new treatments as well that some people will be eligible for, as we've just discussed. So this is a very different situation from a year ago, with the caveat that, you know, there is quite a lot that we still don't quite know about how this directly relates to Omicron. There's nothing to suggest that it's going to cause people to get sicker than people did with the previous variants of the virus. And in fact, that there is some suggestion that it might be the opposite, which would be good news, but we're not banking on that. We're just hoping that that might be the case. So we've got about 10 minutes left, and I thought we could maybe have a slightly more general conversation around what people should do if they're unwell from their IBD, and how to contact people over the festive period. One of the things that has been a concern for all of us throughout the pandemic, is maintaining our core IBD services. We've had a fantastic team of nurses managing to help us stay afloat in Edinburgh throughout and manning the helplines. But I know many of you will be in different parts of the country and maybe different parts of the world where you haven't managed to have such robust access, and where the nurses have been redeployed and the helplines have not been manned. And I can imagine that causes a fair degree of anxiety. So we're going to just have a brief discussion between us about maybe some tips and tricks to keep well over the Christmas and festive period, who to contact, and what to do if you become unwell. So I'm going to take this to you first, Kerry, and then maybe come to others in turn for some tips on how to stay well and what to do if you become unwell over Christmas.
I think we've already touched on the first point I'd want to make is obviously keep taking your medication, and obviously make sure you've got plenty to last over the Christmas period, and particularly if you're going away, that's often a thing that we get contacted with, people sort of running out sometimes around Christmas. A common thing we always comment on is we're really quiet around Christmas, so I always wonder if a lot of people kind of almost just put up with things over Christmas, and I would urge people to try not to do that if you've got grumbly symptoms now, because I can only comment my own team. We often have a good amount of staff in sort of the week before sort of now, but obviously it's less around Christmas. So if you can, nip things in the bud, there's often little things we can do, just simple adjustments to medication, or just little things sometimes that can make a difference. So and even just sometimes getting a bit of a plan of what to do if your symptoms get worse. So I think definitely try and get that advice either from your IBD team. Crohn's and Colitis UK website have lots of good information about what to do. So I think that would be another thing just to try and do. Trying to think what else I'd thought of before.
No, that's really helpful, Kerry. So what should someone do if they feel unwell and they can't get hold of the nurse helpline, and maybe they can't get hold of the GPs either?
I think there's always the NHS website, and so 111's a really good point of contact if you can't get hold of your main points of contact. There's the pharmacy, your local pharmacist, a good source if you've run out of medication, or 111 would be the places I would suggest for patients to contact.
Yeah, Tarek, you've got an amazingly robust system in place in Exeter, I think, for the festive period.
Well, we have, but we put it in place principally to support access to antiviral treatment. So we do have an on-call IBD nurse who's there to pick up the messages specifically about PCR positive people, as opposed to day-to-day IBD management. But I'm sure that we'll pick up those problems if there are urgent ones. But I would echo what Kerry said, in that we've still got 4 working days left before Christmas. So if you're thinking, oh, shall I bother them or not, I would urge you to do so now in the next few days, whilst in fact I think many centres do have a little bit more time, where most of us are at work in the run up to Christmas. So do call.
Yeah, quite often clinics are cut back and things as well, so it is definitely worth getting in touch sooner rather than later. And there will always be people around in the gap between Christmas and New Year as well. But if you're ever really worried and feel acutely unwell, don't just sit at home because you can't get hold of someone. Don't wait over the long weekend just in case you might be able to get your IBD nurse on the Wednesday. If you're really worried, then get yourself attended to urgently, please. Nick Powell, what would you like to add to that?
So I think they're all great points so far. I think the other thing I'd probably add is that the holiday period is usually a very happy time for most. It can also be quite a stressful time. And I think looking after your mental health during this period is actually really important. Looking after yourself, making sure you sleep adequately. Everyone's going to want to sort of party, see their families and that sort of thing. But that sort of ability to look after yourself. People know their triggers often, trying to avoid the triggers that might, upset them during that sort of period of time. And especially that mental health thing, families, as joyous as they can also be a source of enormous friction, and just having some attendance to those mental health issues, which many people have during this period, and trying to keep that mental hygiene going during this often stressful time too is also quite important to prevent trigger relapses, I would say.
Yeah, that's great, Nick. I mean, I think get some exercise if you can on a daily basis, if you're able. Try to get outside and get some fresh air and connect with nature, and just really do some really sort of simple hygiene things. I think that's a really, really helpful point. There's also, I know Ruth would want me to say that Crohn's and Colitis UK hosted a Facebook Live specifically on mental health, and I believe it was very practicable and actionable with takeaways. So that's available to watch, I think, on the Facebook page, Ruth, or on the YouTube channel for people who want to go and visit that again. We can maybe put a link to that directly in the chat below here, to direct you straight to that. Nick Kennedy, do you want to come and add anything to that?
I'd echo what others have said. We obviously all wish that all of the patients with Crohn's and colitis here have a lovely Christmas, and look after yourselves. And we'll look forward to answering more questions at an update when there's more information to give you sometime next year.
Yeah, thanks, Nick. I mean, I think I would just come back and echo to this, that the rapid uncertainty that's come about here because of Omicron I suspect it feels a bit like it's come out of nowhere and just caught us all a bit by surprise. I certainly feel that way a bit, that sort of sense of deja vu of, gosh, how do we suddenly end up back here again 5 days before Christmas? Whilst there's a lot we don't know, hopefully this will come and go quite quickly, and then we will be in a position when everyone's, or even more people, are fully vaccinated with third doses and boosters, that we can resume a much more normal life in 2022. I think we can but hope from that point of view. Ruth, I'm going to hand it back to you.
That's brilliant. Thank you so much to our panel. Thank you to Charlie, Nick, Tarek and Kerry. It's been really fantastic, and thank you for your time. So lots of useful tips and advice and information there. So thank you to everyone that's attended, everyone that's been posting comments and questions in the chat. We've recorded this, so it will be posted up on the Facebook page, and we'll also post it in our YouTube channel as well. And we're hosting more Facebook Lives in 2022, so keep an eye on the website for those. And really just to say that the information is changing really very rapidly. So keep an eye on the Crohn's and Colitis UK website. We'll be putting information up there as it becomes available. And obviously you can also contact our helpline as well over the next few days if you have any questions. So thank you to everyone on the panel. Thank you to everyone who supported and made the Facebook Live possible. And thank you to everyone that's joined us tonight as well. Thank you.
Thanks. Good night.